Tonight.
I was in the middle of a workout and all of a sudden I just got a piercing headache, as if someone was taking a knife and repeatedly stabbing me in the head.
An ABC 27 special presentation.
When we asked him to smile, it was just a lopsided smile. We knew he was most likely having a stroke.
I didn't believe until I saw him there at the hospital, laying there, not being able to move and barely being able to speak.
Penn State Hershey Stroke Center presents Stroke Smart, brought to you by Penn State Milton S. Hershey Medical Center.
Good evening, I'm Chuck Rhodes. Stroke is the fourth leading cause of death in the United States. Each year, about 795,000 people suffer a stroke, and over 140,000 people die each year from a stroke. Now, 75% of all strokes occur in people over the age of 65. However, as you'll see tonight, younger people can and do have strokes. Tonight's specialists from Penn State's Hershey Stroke Center are in the ABC 27 call center to answer your questions. Now, just call the number on the bottom of the screen, or you can email your questions during the show to questions@abc27.com. Dr. Ashkal Patel will answer your emails throughout tonight's show. All calls, as always, will remain confidential. Same for the emails. And we begin tonight with Deborah Pinkerton sharing one of those patient stories. Deborah?
Thanks, Chuck. A college student had high hopes for his 4 years at Gettysburg College. It turns out he achieved much more than he ever expected. Corey Weissman has dribbled a basketball for as long as he can remember.
Basketball has always been my life. There's just some sort of satisfaction that I got just having the ball in my hands.
Just from an infant or soon thereafter, he just always had to have a ball in his hand.
I was looking back at pictures, still pictures, that there's a basketball in every picture and that I did not put there.
At Jackson Memorial High School in New Jersey, Corey made an amazing record. He scored more than 1,000 points.
Scoring 1,000 points is just an incredible achievement for me. All the hours of hard work that I had put in, it was just a symbol of, all of my hard work paying off.
Gettysburg College knew Corey was a gifted player and wanted him to shoot baskets for the Bullets.
We need kids who can dribble, pass, and shoot, and he has the ability to do those things plus score.
Corey played in 3 games his freshman year. After the season was over, Corey continued to train. 4 years ago, he was lifting weights with his buddy Brendan.
I was in the middle of a set and workout, and all of a sudden I just got a piercing headache. He saw that I didn't look so good, and I was starting to get dizzy, and I guess my face was a little bit pale, and he said, why don't we just go outside, let's go to the hallway, get some water, see if you feel a little bit better.
Brendan took Corey to the athletic training room to get help.
About halfway there, I started to stumble, and my left leg started to drag on the floor.
As he came in, I went to put my hand behind his back to help walk him in, and he almost went limp and needed assistance. I asked Corey to, I was on his left side and asked him to squeeze my hand, and he was unable to squeeze my hand with his left hand, but reached across with his right to try to squeeze my hand with his right hand. And that's when we asked him to smile. And when he did smile, it was just a lopsided smile where only the right side went up. And that's when we knew he was most likely having a stroke.
Corey's parents quickly found out the news.
A nurse takes the phone and says, Mrs. Weissman, this is the nurse. Your son is in very serious condition. I don't know if they said critical, I don't remember the words. He had a subarachnoid hemorrhage. He had a bleed in his brain, and he's really, really sick.
Tina, my wife, called me. I was working about an hour away from home, and she was close to hysterics and said something happened to Corey. Told me in brief what she knew, that he had apparently had a stroke, and it seemed so unreal. I really couldn't even digest it.
They packed their bags and made the 3-hour trip from New Jersey to Penn State Hershey Stroke Center.
The weather was awful. I was just very determined to get there as quickly as we could, just to see what was going on.
Let me get there and see him alive. That's all I could think about. Let me just get there and save a life.
When he came into the hospital, he was awake and alert, but it was clear that he had had a stroke. He was very weak on his left side, his face was weak, and his left arm and left leg were weak.
And then we got to the hospital, and Coach met us downstairs in the parking lot and walked with us upstairs to this room of, I didn't know what to expect.
This was a kid that was always so healthy and vibrant. I didn't believe until I saw him there at the hospital in the critical care unit, laying there, not being able to move and barely being able to speak. And then it hits you, you know.
Doctors explained Corey's condition.
The scan showed that he'd had bleeding into his brain, and the bleeding was located in the frontal lobe on the right side. What caused his bleeding turned out to be a blood vessel malformation, an arteriovenous malformation, or AVM. And this is an abnormal tangle of blood vessels where the arteries are directly feeding into the veins and creates a tangle of vessels like this. And it looks like a can of worms or a bowl of spaghetti. And this creates weak points in the vessels, which can lead to bleeding and lead to the stroke that Corey had.
He showed us the angiogram on the screen, completely showed us Corey's brain, showed us the bleeding.
Dr. Cockcroft explained the procedure to initially treat the AVM.
The procedure that I personally did was called embolization of his AVM. And what that involves is taking a very small catheter about the size of a thin piece of spaghetti and putting it directly into one of these arteries that's feeding that tangle and injecting through that a liquid glue-like substance, which then causes these vessels to seal up or plug up.
It worked. After about 5 days, doctors knew Corey would get better. So did his parents.
I'll never forget, I don't know what day it was, but I will never forget the day that he made a joke, and it was like so reassuring. It was like, my son's alive, he's like there.
Corey spent 12 days at the med center and was more than ready to go to a rehab center in New Jersey.
My goal from the time that I was fully awake in the hospital was to play basketball again, to get back out onto the court. That was my motivation. That's what drove me to work hard.
When he left Hershey, he could barely sit up by himself. That's how weak he was. They had him up the next day walking, that is, being held up on parallel bars.
Very quickly, he started to show me, look, Ma, I can do this. You know, I can do this. I can move my elbow, like very small increments, but each day, or every other day, he showed me something else he was able to do.
I was wheeled in there on a stretcher, and I couldn't move anything on the left side of my body. And by the time I left, a month later, I was walking with a cane, with a very severe limp, and still a lot of motor deficits, but I walked out of there, which was a goal of mine.
Corey was moving in the right direction. Now doctors needed to take care of the problem that caused the stroke. We'll show you the rest of Corey's story in a few minutes. Chuck, back to you.
That's a remarkable story, that young man. Now joining us in the studio is Dr. Ray Reichwein, the co-director of the Stroke Center at Hershey. And Doctor, when I hear the age 19, that just jumps off the page at you. Is that really unusual to have a stroke at that age? I mean, it just seems so out of whack.
No, individuals can have a stroke at any age, and we're starting to see more and more young strokes. Some of the same common risk factors that older individuals have, some unusual ones. Younger individuals can have congenital heart disease with trauma, tear blood vessels. Some have clotting disorders. Those are more common.
What are the most common strokes? When we talk about that, I know it's one catchphrase, but what are some of the most common strokes?
The most common kind of stroke is called an ischemic stroke, and that is where a clot or a piece of plaque material blocks up the blood vessel, and the blood flow to that brain area is cut off, and that tissue dies over a period of time. That accounts for about 85% of all strokes. The remaining 15 are brain hemorrhages, as in Corey's case, and commonly due to either aneurysms or vascular malformations. In an older person, one of the more common causes is just poorly controlled high blood pressure.
Is there such a thing as someone's more risk for a stroke than others?
Correct. There are many common risk factors that many of us have out there in society, And those include high blood pressure, diabetes, smoking, excessive alcohol use, obstructive sleep apnea, and the list goes on and on. One of the other more common ones to mention are blockages in either the neck or the brain arteries, particularly the carotid arteries in your neck. And then lastly, cardiac causes and a regular, often silent heart rhythm with advanced age called atrial fibrillation is one of the most common causes in an individual in their 70s and 80s.
Let's talk about the time factor for treatment of strokes. How important is that from the time of the stroke till they get treatment?
It is critical, and the motto in the stroke world is time is brain. And for every 15 to 30 minutes of brain injury, you can lose millions of cells. And millions of cells will quantify into disability to some degree, and the longer and the more severe, the more disabled. With that being said, our best treatment for clot-based strokes or ischemic strokes it's the only FDA-approved treatment, is an intravenous clot buster called TPA. And that has to be administered within 3 to 4.5 hours from the onset of your symptoms. So it becomes very critical.
Yep. What about the symptoms?
So the symptoms still many people aren't aware of, and only about a third or more people still know the common ones. And the main ones are two things. There's sudden onset and you lose something depending on the brain area affected. Commonly speech or language is one, and the other one is loss of motor function, commonly either a face, arm, or leg droop. And the acronym out there is something called FAST, F-A-S-T. So if there's a facial droop, arm weakness, there's something wrong with your speech, T becomes very important. Time and calling 911, getting promptly taken to stroke centers.
You touched on it briefly, new treatments for strokes. In the 10 years you've had the center there, talk about that.
So things have evolved over time, and we're now evolving into different new clot busters. We now have new catheter-based devices to where, as you'll see later, we can pass a catheter up into the brain artery that's blocked, and with special devices take the clot or debris out. Brain cooling has become more common and is currently still
brain cooling.
Brain cooling, so cooling down the body or the brain to try and protect cells while we reestablish blood flow. And then lastly, we've just begun doing research into intravenous stem cell infusions that are begun within a few days of the stroke to hopefully enhance recovery.
A lot of new things on the horizon.
Correct.
Thank you for joining us tonight, Doctor.
Thank
We're going
you.
to check back with Deborah Pinkerton in the ABC 27 call center. Deborah, it's busy over there.
Chuck, it's very busy. The phone lines are ringing, so the number to call once again is 717-346-3333. Here to answer our viewer questions this evening is the stroke manager there at the Med Center, Kathy Morrison. Thanks for being with us.
Thank you.
This is the first viewer question. My dad had a stroke in his early 60s, and my mom developed dementia in her 60s. I'm a 40-year-old overweight female, and I have been switching my words around a lot when I speak. Am I at risk of having a stroke because of my family history?
Not necessarily. Family history certainly is a red flag. Other things can cause your problems, fatigue, stress, anxiety. But with that red flag history, if you haven't talked to your family doctor for a while, haven't had a good physical, that's the next thing you should do.
Okay, thanks so much, and we'll talk to you a little bit later. Once again, the phone lines are busy. If you can't get through on the phone lines, you can email your question to questions@abc27.com. Stay with us. We will be right back.